Pain is a highly complicated, multifaceted process that is experienced differently by each person. I have made this video to help you understand some of the mechanisms that may be causing your pain, because understanding is the first step towards management. I want to start by reinforcing the fact that your pain is real, whatever the cause may be, and I look forward to working with you to manage this pain so you feel listened to and empowered about your experience of your pain. Let's start by learning what pain is. One definition of pain is an unpleasant sensory or emotional experience associated with real or perceived tissue damage. It is perceived uniquely by each individual. There are two main types of pain, acute and chronic. When you stub your toe, nerves send signals up to your brain where they are interpreted as pain. This is a normal and healthy response of your body and is important because it acts as a protective mechanism that can stop you from injuring yourself further. Once the tissue begins to heal, pain levels will decrease until they subside completely as the injury resolves. Chronic pain is more complex. With chronic pain, the receptors in your skin and internal organs become more sensitive. This can cause stimulation that you might previously ignore to be interpreted by your brain as pain. Once again, whatever the cause, this pain is real. Your body has ways of regulating the amount of pain signals that enter your brain. At the same time your body is sending pain signals up the spinal cord, your brain is sending signals down the spinal cord that decrease the number of pain signals that make it up to the brain. These are called inhibitory signals, and they work like a faucet, with your brain in control of the flow rate. In the presence of acute pain, these signals are beneficial because they help you avoid excess suffering once the initial threat of pain has passed. In the presence of persistent pain, the number of inhibitory signals is reduced, and more pain can flow up to the brain. This occurs whether an outside source is physically harming you or not. Your pain may have initially been caused by tissue damage, but at this point in your process, we may not be able to point to a specific structure on an X-ray or a CAT scan as the cause of pain. I want to remind you that findings on medical images can often be misleading or inconsistent with the cause of your pain. Another factor that greatly affects your experience of pain is context. Your body is more sensitive when you are under stress, or if the injury will cause greater lasting problems than the pain itself. Consider how you might experience pain differently if you bang your knee when you're in a mad rush on the way to work. You might simply ignore the pain initially as your mind is preoccupied with rushing to work. But then once you sit down and allow your attention to be dominated by your knee, your pain will likely increase. Your brain can interpret any new sensations as painful or treat older injuries as continued threats, therefore creating persistent pain. Now you can see how the problem of persistent pain is compounded by increased sensitization of pain receptors, decreased control of pain signals entering the brain, and the context, which can alter your experience of pain. I want to reiterate that whether the pain is caused by specific tissue damage or due to perceived threats from contextual factors, your pain is real and should be listened to seriously. Luckily, there are many treatment strategies that have been shown to help reduce chronic pain. This can actually create physiological changes in your body and the way your brain perceives and interprets pain. It is my intention to create a treatment plan specifically catered to your unique experience of pain so we can work together to improve your quality of life.